I'm going to start with the man in Indiana, but I promise you this is about much more than just a story in Indiana. Instead, it's a story about the complete failure of ICE and the Trump administration to keep people safe who are under government detention. And it's about the gross misconduct of the Trump administration as a whole. In January, a man named Andronique Grigorian was being held by ICE at a state prison in Bunker Hill, Indiana. He has epilepsy, and one morning there was no medical staff on duty to hand out the morning doses. So he did not get his anti seizure medication he had been taking for years. Hours later, he seized, hit his head, and was found lying in a pool of his own blood. He was patched up at a local hospital and sent back the same exact day. And then, according to lawsuits the ACLU of Indiana filed this week, when he was too disoriented to stand and asked officers why they were moving him to another unit, they opened the port in his cell door and pepper sprayed him in the eyes. He never got a shower, and he had to try to rinse off the pepper spray in a sink. Now, if that were one horrifying story, it would be a scandal. It is not one story, it is the template. And once you know what to look for, you see the same three failures over and over again at facility after facility in state after state. Somebody's medication stops arriving, somebody's emergency gets treated as an inconvenience, and nobody is left in the building whose job it is to notice. Let me walk you through what it actually looks like. In February of last year, a 44-year-old Ukrainian man named Maxim Chernyak was at the Chrome Detention Center in Florida. He came to the United States on humanitarian parole. He had a work permit and a social security number. He had also been repeatedly telling staff that he was experiencing chest pain and had an irregular heartbeat, and his blood pressure was running high every time they checked it. And there is no record that anyone ever prescribed him anything for it. At midnight, a medical emergency was called on his behalf. At 2:32 a.m. in the morning, a nurse found him unresponsive with pupils that were dilated and would not react to light, which is a sign any trained provider should recognize as a brain emergency in progress. Instead of calling 911, they moved him to the facility clinic. A provider on the phone ordered non-emergency transport. He did not reach an emergency room until 4:43 a.m. By then, his blood pressure was over 280. He had suffered a massive brain bleed, and he never woke up. The working theory the staff had been operating on, according to their own communications, was that he was on drugs. That September at the Adelanto facility in California, a 34-year-old man named Ismail Alia Uribe reported a fever, a persistent cough, and a growing abscess. His lawyer says staff ridiculed him for it. According to the government's own report, a provider gave him pain medication, anti-inflammatory ointment, and a fiber supplement and sent him back to his cell. There is no documentation that anyone ever performed a physical examination, which is the thing that would have found the infection. 3 days later, he was vomiting and shaking. He died of septic shock before he could get to surgery. He had lived in this country since he was 4 years old and had worked at the same car wash for 15 years when Border Patrol raided it. 4 days before that incident, at a county jail in New York, a 42-year-old Honduran man named Santos Vinagas Reyes went through intake. Staff identified him as being in active alcohol withdrawal, which is a condition that kills people when it is not managed and almost never kills people when it is. He was cleared for detention within 2 hours. According to his attorneys, nobody checked on him from 1:32 in the morning until 6:25 the next morning, when a guard found him dead in his cell. He had been in ICE custody for 17 hours. And at the Eloy Detention Center in Arizona, a 45-year-old Ethiopian man named Seyrey Wheat Dejane went to medical 4 separate times over 6 weeks for back pain and was treated for a pulled muscle every time. By the time anyone looked harder, he had lost 20% of his body weight. A hospital told the facility he probably had lymphoma. He did not. he had tuberculosis. And an autopsy later found that he had untreated HIV that had progressed to AIDS, along with a list of other infections. He had been housed in the general population that entire time with active, contagious tuberculosis. Nobody has said whether the people around him were ever notified. I want you to notice something about these four cases. Not one of them is a story about a rare disease or bad luck. Every single one is a story about somebody telling staff they were sick and simply being waved off. The pattern runs through mental health care too. In the first year of this administration, 7 people died by apparent suicide in ICE detention. The year before that, the number was 1. And at Camp East Montana, the tent camp on the Fort Bliss Army Base in El Paso, that is now the largest immigration detention facility in the country, a man who was deported in March told NPR he watched as a detainee collapsed while people pounded on the windows, screaming at guards that they were killing them, and that the guards laughed. He said he also heard officers betting on which detainee would die by suicide next. He said he personally talked 3 people out of it. When federal inspectors went through that facility in February, they documented 49 violations of detention standards, covering use of force, restraints, and medical care. The most any other inspection turned up that year was 13. One attorney's summary was that the camp gets an F. In June, government auditors reported that evidence in a detainee's death investigation at the facility had been destroyed or lost. Then there is what is happening to pregnant women, which the government was forced to put numbers on this spring. Between January of last year and mid February of this year, ICE deported 363 people who were pregnant, postpartum, or nursing. As of that February date, 86 pregnant women were in ICE custody, including 9 in their third trimester. 16 miscarriages were recorded in detention. Women and their attorneys have described being shackled at the ankles, wrists, and waist during transport, being denied prenatal vitamins, and being watched by guards even while giving a urine sample. One woman miscarried, was hospitalized, was returned to detention still bleeding and in pain, and waited 11 days for a follow up. Another was deported 10 days after being diagnosed with a miscarriage that had not fully passed, a condition that invites serious infection and needed emergency care the moment she landed. ICE's own written policy says these women generally should not be detained at all. So let's talk about the scale, because this is where people would usually assume I'm cherry picking. In June, Human Rights Watch and Physicians for Human Rights published a joint analysis. In the first 500 days of this administration, 52 people died in ICE custody. 39 of them died in the first year, which is the highest annual death toll since ICE was created in 2003. The mortality rate is the highest it has been in nearly 2 decades, roughly 4 times the rate under the previous administration, and higher than it was at the peak of the COVID-19 pandemic. It is not simply a matter of holding more people. The detained population grew 77%, and annual deaths more than tripled. As of the middle of this month, at least 22 people have died in ICE detention in 2026, and we are only in July. Here's why it keeps happening. The care is contracted out to companies that face no meaningful penalty for failing. In Indiana, the provider is Centurion Health, a subsidiary of insurance giant Centene. It currently faces more than 150 active federal lawsuits in that state alone over conditions of confinement. Missouri has fined it for missing standards every single quarter since renewing its contract. A whistleblower suit in Delaware that the state attorney general joined accuses it of falsifying records and concealing staff shortages. And when Indiana extended its contract, the state removed the clause that made the company pay the money back for missing its staffing requirements, and then renewed again this March for roughly $213 million. Camp East Montana, meanwhile, is run under a $1.3 billion contract by a company that has never operated a detention facility before. Then there is the money that is not moving at all. For more than 20 years, the Department of Veterans Affairs processed the reimbursements that pay outside hospitals, pharmacies, and specialists for treating detainees. ICE paid the VA for that service. In October of 2025, under pressure from a right wing legal group, that arrangement was killed. ICE handed the work to a private contractor. In its own procurement documents, ICE called the situation an absolute emergency and specifically named dialysis, prenatal care, and chemotherapy as the care at risk. As of last month, that contractor had collected $44.6 million and had paid outside providers exactly nothing. Not a reduced amount, zero. For 9 months. Some providers have simply stopped accepting these patients. And the people whose job it was to catch all of this are gone. The Office of the Immigration Detention Ombudsman, which Congress created in 2019 specifically to investigate abuse and medical neglect in immigration detention, went from more than 100 staff at the start of the year to 5 to permanently closed in May. The department's civil rights office was gutted alongside it. The administration's own stated reason for the cuts was that these offices were internal adversaries that slowed down operations. Oversight was slowing them down, so they removed oversight. Think about that for a second. And it worked. Nearly 2/3 of required death notifications were published late. And when medical experts reviewed all 39 first-year deaths, they found the government had not released enough information in a single one of those cases to determine whether the person could have been saved. One last thing. Because the response to all of this is always the same, when reporters asked about the deaths in Indiana, an ICE spokesperson said the claims were false and then tried to add that it was the best healthcare many of these people have ever received in their entire lives. Set that against the actual record. A man with a brain bleed loaded into a non emergency van. A man with a raging infection sent back to his cell with ointment and a fiber supplement. A man dead of alcohol withdrawal just 17 hours into custody. And another man carrying active tuberculosis through a housing unit for 6 weeks because 4 different staff members told him it was his back. And then women miscarrying in shackles. And now understand who we are talking about. As of April, fewer than 18,000 of the more than 60,000 people in ICE detention had any prior criminal conviction. Roughly 24,000 had neither a conviction nor a pending charge. These are civil detainees. Legally, this is not punishment. It is supposed to be custody to make sure someone appears at a hearing. The Constitution requires that they get adequate medical care, and that it is not a courtesy. That is the whole basis on which the government claims the right to hold them. None of this is an accident. Every piece was a decision made by someone with a name and a title. The decision to fill facilities past capacity with people who have never been convicted of anything. The decision to hire contractors with documented histories of understaffing and then delete the penalty for understaffing. The decision to detonate a functional payment system with nothing ready to replace it. The decision to fire the inspectors. Those choices have a body count, and it is climbing every single week. If you agree that the Trump administration and ICE are acting unconstitutionally, give me a follow because you're my kind of people.